Hello, I want to talk to you briefly about arthritis. If you cut yourself 3 or 4 days later, it's gone like magic. It's because blood gets to the cut, stem cells get turned on by the platelets in the blood, and everything knits back perfectly. But it doesn't happen that way in knees, hips, or the discs in your spine. Those areas don't have a good blood supply once you reach the age of 6 to 8 years old. And so when you damage a knee or a hip or a disc in your spine, it can't heal on its own very well. So gradually over time, those areas decay. Discs will thin. The body will deposit calcium in an attempt to stabilize the area. Knee joints will thin the cartilage in the knees, and the same thing with hips. So until now, there's been very little we could do about stopping that progression. I mean, there are nutrients you can take, but it's very variable. Some people say they get results, some people don't. There's no good medical treatment for it. We're taking oral medication to cover up the symptoms. And look, if you have to keep taking medicine over and over again, it's not fixing the problem, right? It's kind of easy to figure that one out. And then eventually we take steroid shots, which by the way are very bad for you. Anything you can only do 3 times a year is either really bad or really good. And in this case, steroids are really bad for you. For 4 years, I did it. I mean, I was, I controlled a pain management clinic and did those shots. But they're temporary at best. And what they do is they break down long-term the cartilage. And so for short-term relief, anywhere from 3 hours to 3 months of relief from a steroid shot, you're actually doing yourself harm because it breaks down the tissues and you wind up actually being worse down the road. So let's not do steroid shots. So anyway, I want to talk to you about a better way, a natural way, the robotic deep tissue laser. It draws out inflammation and arthritis, disc degeneration, hip degeneration, knee degeneration is arthritis, and anything with an itis on the end means it's inflamed. So what happens is the deep tissue robotic laser is transdermal. It doesn't cut. There's no tissue destruction. There's no downtime or pain. But it draws out inflammation, like doing a steroid shot, but no steroids. So you feel better, but it does more than that. It actually causes blood infiltration back into the stagnant, decaying arthritic area. So in knees, hips, and the discs in your spine, it can actually put blood supply back into the area, increase blood supply in the area, platelets in the blood turn on stem cells, and you can actually get tissue regeneration. So anyway, hey, you don't have to just take pills and do steroid shots and then ultimately a knee replacement, hip replacement, or surgery on your back. This is an alternative. So God bless you guys. Hey, have a great day, and I hope this was beneficial to you. Bye.